Good afternoon. My name is Andrew Wilson. I'm here to present our EBP poster presentation for Group 11, which our study was about the community naloxone distribution and opioid use disorder. Opioids are a class of drugs that have been used for centuries to treat pain effectively. While the powerful analgesic effects opioids produce prove beneficial as medical treatment for various acute and chronic conditions, they are often misused and subsequently abused due to their euphoric and depressant effects on the central nervous system. From 1999 to 2018, the number of drug overdose deaths quadrupled, and almost 70% of those deaths involved an opioid. According to the United States Health Department of Health and Human Services, 2 million people in the United States suffer from opioid use disorder in 2018. While genetic factors play a major role in the development of opioid use disorder, environmental factors such as the ease of access to opioids greatly contribute to the risk of developing opioid use disorder. Studies and current CDC recommendations focus on the opioid antagonist naloxone, also called Narcan, to treat opioid overdose. Naloxone, when given in time, effectively reverses the CNS depressing effects of an opioid overdose. The significance of this is that there is a strong correlation between the marketing of opioid pain killers beginning in the 1990s and opioid use disorders as we know it now. Naloxone is the standard overdose treatment. It has few known adverse effects, has no potential for abuse, and is available at a reasonably low cost. The administration of naloxone is widely regarded as easily teachable. It involves either an IM or intranasal spray, but its administration and subsequent opioid reversal effects are time sensitive. A hesitancy by bystanders can delay this timeline to call EMS because of fear of police interaction, which slows a critical intervention. As such, a bystander who has naloxone and the understanding of when and how to use it represents the quickest route to delivery of naloxone and can be life-saving to someone experiencing an overdose. Given these factors, this led to our PICO question, which is, in patients with opioid use disorder, does the distribution of naloxone to lay people within the community decrease mortality when compared to those communities where layperson naloxone distribution is not practiced? The resources used for the research were high-yield search engines that were peer-reviewed and widely accepted within the medical community. Ultimately, 5 search engines were used to find relevant articles that covered the PICO question. Those search engines were Medline, PubMed, Google Scholar, SynHall, and ScienceDirect. The search engine was organized to focus on articles published within the last 10 years that addressed the PICO question and drew the research closer to an appropriate conclusion that was based on research and methods for community outreach and use of naloxone. The results. According to the literature review, the distribution of naloxone amongst the community has been shown to decrease mortality rates. In 2018 review of 41 studies showed that overdose education and naloxone distribution through lay people education programs are sensible and that lay persons are willing to give naloxone for witness opioid overdose. This also shows that naloxone distribution has a direct correlation with reduced emergency department visits when naloxone has been introduced as an intervention for opioid users to take home or has been given to a lay person. In summary, the data outline recommends distribution of naloxone into the community and providing education to reduce overdose-related deaths. In conclusion, medical practitioners and community programs should continue efforts to promote naloxone distribution and education to reduce overall mortality and ease this epidemic's health and economic burden. With the high usage of opioids for both pain management and substance abuse, there must be creative and sustainable solutions such as community-based program and pharmacy-supported access to naloxone. Furthermore, locating sites for the local distribution of naloxone to the community is an important step. These sites could include hospitals, urgent care centers, pharmacies, businesses, community programs, and schools. Thank you very much for your time, and have a good day.